your first and last names.
Richelle Jody Cooper. Richelle, it's R-I-C-H-E-L-L-E. Last name Cooper, C-O-O-P-E-R.
Good afternoon, Dr. Cooper.
Good afternoon.
Let me provide you with instructions which I give to every witness in every case. The first of which is to please sit back and relax. The second of which is to speak in a loud voice so all of us can hear you. The third of which is to answer questions yes or no if called for, rather than using slang, And the last is to wait until you hear an entire question before responding, so that we don't have people speaking over each other, even though we think we may know what's being asked. Is that okay?
That's okay.
Thank you.
Thank you.
Direct. Mr. Waldron.
Good afternoon, Doctor.
Good afternoon.
Dr. Cooper, where are you employed?
I'm employed at the Ronald Reagan UCLA Medical Center.
And
We may need you to speak just a little closer to the mic if you could. Thank you.
And what do you do at the Ronald Reagan UCLA Medical Center?
I'm an emergency medicine physician.
Okay. Now, in order to become an emergency medicine physician, I want to ask you a bit about your background. Can you tell us your basic educational background that allowed you to pursue a field as an emergency room doctor?
I completed 4 years of college and had a Bachelor's of Science, and then went on to medical school, which was another 4 years.
Your Bachelor of Science was in what?
In kinesiology from
And what is
UCLA.
that?
It is, it was the science of movement, neuro processes that assist with movement, anatomy of movement.
Okay. And following that, getting a Bachelor's of Science, what year was that?
I finished in 1990.
Okay. Following that, what did you do?
Then I went on to medical school at the UCLA School of Medicine,
Okay.
and I earned my MD in 1994.
Okay.
And then I matched into a residency program.
What does that mean?
When you finish medical school and you apply for training programs, there is what's called a match, and you apply to different programs, you interview at programs, and the students are matched with the programs.
Okay. And you matched into which program?
I matched into emergency medicine at UCLA.
Okay. And then following getting your medical degree in 1994 and then matching into this program, what did that involve for the next year?
So, emergency medicine in the program I was in is a 4-year program.
Okay.
My first year was an internship, which I actually did at Harbor UCLA. And then I completed 3 years of emergency medicine training at the UCLA Olive Emergency Medicine program.
Okay. And the first year of that 4-year program, the internship, that was at Harbor UCLA?
That was at Harbor UCLA.
What did that involve?
That was a transitional year internship. It's a rotating internship on various medical services.
Okay. And then the residency, the 3 years of residency, what did that involve?
That was specific training in emergency medicine.
Okay. Then what year did you finish your residency fellowship?
My residency finished in 1998.
Okay. That's what I meant. You finished your residency in 1998, and then what did you do?
Then I actually went for further training, and I completed a 2-year research fellowship in which I obtained a Master's of Science in Health Services from the School of Public Health.
Okay.
And worked as an emergency physician, and finished that in 2000.
Okay, so during that time, you then began actually work as an emergency room doctor?
Yes.
Okay. And from that point on, what have you done with your career?
I've been a faculty member with the UCLA Department of Emergency Medicine.
Okay. And when you say you're a faculty member, what does that mean as far as your daily activities?
I'm currently an associate professor. I'm involved in working in the emergency department, treating patients in the emergency department, supervising the residents in the emergency department, teaching of the residents, and then other academic teaching, research, peer review, journal editing, and other academic pursuits.
Okay. In addition to the faculty academic pursuits, do you also work in the emergency room on patients on a daily basis?
Monthly, we have a certain number of shifts, but yes, on a regular basis.
Okay. And are you board certified in emergency medicine?
Yes, I am.
What does that mean to be board certified?
You first need to complete a specific training in emergency medicine to be board eligible, and then you go through a certification process. Initial certification involves first passing a written exam and then passing an oral exam. And then you must continue to have further certifications and sort of approval of and continuation of your education and recertification every 10 years. So I was certified initially in 1999, and I recertified in 2009.
Okay, and that's good for another 10 years as long as you're continuing with the education and training?
Yes.
Now, directing your attention to June 25th, 2009, were you employed, as you've indicated, as an emergency room doctor at UCLA Medical Center?
Yes.
And that was just part of your regular shift on that day?
Yes.
And did you become aware of radio? Let me strike that. Is there a base station in the UCLA emergency room area?
Yes, there is.
And what does that mean? What is a base station?
So we have nurses that are not just trained as emergency nurses. They have specialized training called a mobile intensive care nurse, or MICN license. They answer radio calls from paramedic runs. They assist with the care of patients that the paramedics provide, and may direct the care at times. If it's not protocol, it may involve the physician to direct the care, and then they will notify the local hospital or our team if the patient is being transported to us.
Okay. So, and I'm just speaking generally just to get an idea of how this works. So if you're the physician working in the emergency room on a particular shift, and there's a radio call and the paramedics are out in the field at scene, they will be communicating with the base station nurse?
Yes.
And as needed, the base station nurse will consult with you to relay information back to the paramedics through the base station nurse?
Yes.
Okay. And on that day, June 25th, 2009, were you involved in this communication with the base station nurse involving a patient that you subsequently learned was Michael Jackson, the decedent in this case?
Yes, I was.
Okay. And to be clear, following this base station consultation and communication, the patient, Michael Jackson, was brought to UCLA, and you were then the attending emergency room physician, correct?
That is correct.
Okay. Now, prior to that time, so when you're still at the ER communicating through the base station nurse, what was your knowledge prior to Michael Jackson's arrival at UCLA?
The radio nurse called me after receiving information from the paramedics, and the nurse scribes a data form called the hospital base station form, which I had. The nurse summarized the information, and I made a determination based on that information to authorize the paramedics to pronounce Mr. Jackson, the patient, I didn't know who it was, dead in the field based on the information I had.
Okay. And that was at, well, when that decision was made, that was at 12:57 p.m.?
Yes.
Okay. Now, prior to your authorization for the paramedics to pronounce Michael Jackson dead at 12:57 p.m., had you been in communication with the base station nurse, kind of in a back and forth capacity?
The radio nurse answered the call, and actually I was called after. I was not in communication during the initial resuscitation. I was called after the paramedics had attempted resuscitation, had not produced any improvement in the patient's condition.
Okay. And so then you were informed that the patient was unresponsive?
Correct.
Asystolic?
Yes.
No pulse?
Yes.
And not breathing?
Yes.
And you were informed of the attempts that had been made through various starter drugs?
Yes. I was informed the patient was intubated and that the ventilation was checked and was appropriate. We believe the patient was appropriately being ventilated. They had tried epinephrine and atropine, and the patient remained asystolic.
Okay. And based on everything you knew and everything that was relayed to you by the paramedics, you, as the on-site emergency room doctor, authorized the paramedics to pronounce the patient dead?
Yes.
Okay. And what did you next learn after you granted that authorization?
The radio nurse then called me back and said that there was a physician on scene who was requesting the paramedics provide other medications.
Okay, and what happened then?
At that point, the medication that was requested was sodium bicarbonate. It's a medicine that if you were to proceed and continue attempting to resuscitation would be appropriate. And I then said that yes, if this was a physician with an active medical license, the paramedics could administer that medication at that physician's discretion. However, they would need to begin to transport the patient to the local hospital. And that physician would have to take over control of the resuscitation and travel with the patient in the ambulance.
Okay. And just backing up for a minute, Dr. Cooper, regarding pronouncement of death, are there certain protocols that are followed, certain information that you need to retain before you would make such a pronouncement, in addition to what I listed off earlier?
The report I had was that on arrival, when the paramedics arrived, the patient had no signs of life, was clinically dead, had an attempted resuscitation, and the estimated time down was at least 40 minutes, which in the LA County field protocol, once resuscitation attempts have been made for about 20 minutes with no improvement, it meets protocol for pronouncement.
Okay. And had you also been informed that the pupils were fixed and dilated?
Yes.
Okay. And then with the amount of time that resuscitation efforts had been ongoing, in addition to the physical characteristics that have been described to you, consistent with the protocols, that's when the pronouncement of death was authorized?
Yes.
Okay. Now, when you then learned that the personal physician wished to accompany Michael Jackson, that's when you authorized, or directed, rather, that the physician would have to accompany the patient to UCLA?
Yes. If a physician is going to take over base station control and order treatments of the paramedics, that is a requirement.
Okay. So at that point, at least while Mr. Jackson was at the 100 North Carrollwood location and during transport to UCLA, the personal physician would be the one who had assumed care?
Correct.
Okay. Now, do you recall about what time the paramedics arrived at UCLA?
I believe it was around 1:13, 1:14.
Okay. And upon arrival at UCLA Medical Center, at that point, is care then taken from the personal physician and taken over by you, the attending emergency room doctor?
Correct.
Is that what happened?
Yes.
Okay. And do you recall where you were when Michael Jackson, the decedent in this case, was first brought into the hospital?
When I had already been sort of prepared that we had a patient who was being resuscitated coming in. I was standing right outside the trauma bay so I could see the ambulances that arrived.
Okay. Your Honor, I have a series of photographs here. I'd like to mark them in order. They've been shown to defense counsel previously.
Again, shown to Mr. Chernow.
Photograph of a trauma room. May this be marked Peoples 47.
Go ahead and order, and I'll mark them at the end.
Okay. Same room, different vantage point. Peoples 48. Close-up of medical equipment, Peoples 49. And a picture of a hallway looking out to the paramedic bay, Peoples 50.
47 through 50.
Thank you, Your Honor.
Thank you.
I take a quick look at them.
Again, sure. Mrs. Benson, could you get
Thank you.
Thank you.
Dr. Cooper, do you see People's 50 up on the screen?
Yes.
Okay. And do you recognize what is shown in People's 50?
It's the hallway, the back hallway, where our 2 trauma bays are.
Where, I'm sorry, where what?
We have 2 trauma bays,
Okay.
and that's the hallway. And at the end of the picture, that is the ambulance arrival.
Okay, you say the end of the picture. I'm pointing here
Yes.
to these glass doors to the rearmost section of the photograph. Is that where the ambulance would pull in to bring in a patient?
Yes.
Okay. And looking then from this vantage point to the right of the hallway, is this the trauma room
Yes.
to which Michael Jackson was taken?
Yes.
Okay. So when you indicated that prior to the paramedics' arrival with Michael Jackson, you were prepared. What did you do to prepare?
I supervise residents, so we had the residents. When we have a code coming, there are a number of additional providers who are called. So a pharmacist was called and was in the department, in the trauma bay waiting. A respiratory therapist would already be there. Our social worker would be notified, and the charge nurse would assign nurses to the room.
Okay.
I would then prepare my residents for what needed to be done immediately when the patient arrived and assign who would be assessing the endotracheal tube, who would be assessing for pulse, who would be looking at the heart, and what we would initially do.
Okay. So if you could, the team that was being assembled prior to Mr. Jackson's arrival, that included yourself?
Yes.
And you mentioned residents. How many residents?
There were 3, I believe, initially in the room, and there's another resident who had come to check and assist. So there were 4 of my residents in the room.
Okay.
May we turn up the light for a
Please,
moment or not?
please. That's fine.
May we? Thank you.
So you, the 4 residents, any technicians?
There were, I believe, a couple emergency medicine technicians to perform CPR, help place the patient on the monitor.
I'm sorry, to perform CPR and help place the patient?
They're the ones who will place the patient on the monitor, will help run or grab equipment and assist us.
Okay.
We're having some audio issues. Is there a way to turn it up? Or turn it up? Dr. Cooper, could you see if that works? So it's sometimes a little tough to hear witnesses. Thank you.
Okay.
Okay, in addition to the technicians, was there a respiratory therapist?
Yes.
And what is that person's role?
That person is responsible for continually bagging, delivering ventilations to the patient through the endotracheal tube.
Okay. And you
It's better. Thank you.
Okay.
And you had indicated before a scribe nurse. Was a scribe nurse part of this team?
That is one of the nurses, yes.
And what's the scribe nurse's job?
Their job is solely to record information as it's called out by the team. And they may also be, there's a phone next to where the scribe nurse is, so when I ask for a cardiology consult, the scribe nurse may be the one to tell the central work area to call.
Okay. And then were there any other circulating nurses?
There were probably 2, if not 3.
And what is their responsibility in this type of situation?
So they will attempt to obtain IV access. They will draw bloods as we ask them. They will administer the medications that I ordered.
Okay. And additionally, you had indicated a pharmacist?
Yes.
Okay, so the pharmacist is actually on scene in the emergency room?
Yes.
And I believe you'd said a social worker?
Yes.
And what is that person's job?
Social worker will assist in many ways. Typically, will gather information to contact the family and or contact a primary care physician to obtain extra information to help me out. If there are family members or witnesses who had come in, she will assist, or he will assist them so they're not left alone.
Okay, and then a charge nurse, what is that?
The charge nurse is the person who is assigned to the emergency department and covering sort of all of the patients who would be available to assist and make sure if we needed other staff, could assign other staff. Okay.
So at this time then, on this day of June 25th, the team you assembled, and correct me if I'm wrong, it entailed you, 4 residents, at least 2 techs, a respiratory therapist, a scribe nurse, 2 circulating nurses, a pharmacist, a charge nurse, and a social worker. Does that sound accurate?
That would be the team that started, yes.
And when you say the team that started, what do you mean by that?
There were additional members, doctors who came as consulted by me, and because this was Mr. Jackson, there became security and privacy issues. There were additional administrative people who were involved.
But as far as medical, the initial recounting I gave, that's 14 people. Does that sound accurate?
Yes.
And then other doctors were consulted as needed?
Yes.
So once you have the team together and everyone knows their duties and responsibilities, where were you when you first saw, Mr. Jackson being brought in?
I was right outside the trauma bay door.
Okay. And is that the trauma bay door would be then what you previously identified to the right of People's 50? Is that accurate?
That would be accurate.
Okay, so were you in this hallway here?
Yes.
And were you looking outward through these glass doors?
Yes.
And as Mr. Jackson was brought in to the hospital, did you meet someone who identified himself as his personal doctor?
I believe, and it may have been my charge nurse, someone was outside and met the ambulance and sort of indicated this is the physician. It may have been the paramedics, may have been one of my nurses.
Okay. But brought the physician to you, essentially?
Yes.
Okay. And did you speak to the personal physician at that time?
Yes, I did.
Okay. Do you see that person in court here today?
Yes, I do.
Could you identify that individual, please?
I'm sitting second of left.
Maybe describe what he's wearing.
A dark suit and a light green tie.
Pointing to and identifying Dr. Murray, the defendant.
Thank you, Your Honor.
Thank you.
And as the emergency room doctor, and knowing that a personal physician was present at the house and was present at UCLA, what is your main goal at that point as far as getting information from the personal physician?
So my main goal is to manage the care of Mr. Jackson. And to do that, I took an initial brief history to try and get as much information as possible while the paramedics were transferring the patient from their gurney to our gurney, and the patient was being placed on our equipment. Okay.
And did you, then while they're transferring Mr. Jackson into the trauma room and transferring from one gurney to your work area, were you speaking to Dr. Murray?
Yes.
What did you ask him?
I asked what happened.
What did he tell you?
I was told that Mr. Jackson had been working very long hours, and Dr. Murray thought he had been dehydrated, and that he had given the patient an IV and administered 2 milligrams of lorazepam.
Okay.
And then later had given him another 2 milligrams of lorazepam and observed the patient to arrest.
Okay, let me stop you. Did you ask Dr. Murray if the patient had been ill at all?
I asked several questions. I'm not sure which questions I asked in the initial brief contact, because I then was going to turn to the patient. I asked several questions about the history, sort of in between managing the care of Mr. Jackson.
Was it represented to you by Conrad Murray that Michael Jackson had not been ill?
He reported he had not been ill.
Okay. But that he'd been working hard and he was dehydrated?
Yes.
And did you specifically ask about any medications Michael Jackson had been given?
Yes.
And specifically in response to that question, what were you told?
I was told he was given lorazepam through an IV and then was given a second dose.
Okay. And so that was, when you asked Conrad Murray what medications had been given, you were told 2 milligrams of lorazepam by IV.
Yes.
And then subsequently another 2 milligrams of lorazepam.
Correct.
Is that accurate?
Yes.
Okay. Were you ever told at any point in time about any medications by Conrad Murray other than the lorazepam?
No.
Now, you'd indicated that he also told you, in addition to the total of 4 milligrams of lorazepam, I think you indicated that he said he witnessed the arrest?
Yes.
What does a witnessed arrest mean?
It is an observed arrest. The critical event happens while you are with the patient.
Okay. And when you say the critical event happens when you're with the patient, what is the critical event when you're referring to a witnessed arrest?
The patient stops breathing and their heart stops.
Okay. And to medical doctors and then people in the field, it means you were literally on site and you saw it happen?
Yes.
Okay. Were there reoccurring conversations with Conrad Murray as you're treating Mr. Jackson?
Yes.
Okay. At any time during your attempts to save Mr. Jackson, did Conrad Murray present you with any medical records or any documentation of any vital signs or any medical documentation whatsoever?
No.
And in your subsequent conversations then with Conrad Murray as you're working on the patient, did you learn that there had been mention of Valium and Flomax?
I asked what the patient's other medications are. Those were the two medications were reported that or his routine medications.
Okay, so when you were inquiring about the lorazepam, that was an inquiry about what he had been given, I assume, prior to the witnessed arrest?
I asked what had happened and was told he was given lorazepam and that observed the arrest. I didn't know what to expect or wasn't specifically asking for what medications were given because I did not know what the circumstances of the arrest were.
Okay, so when you simply asked what happened and he responded by telling you about the lorazepam?
Yes.
Okay. And regarding the Valium and Flomax, that was in response to a question about what is he regularly taking?
Yes.
Okay. And what is Valium?
It's a benzodiazepine, a sedative, anxiolytic.
A sedative what?
It's a sedative and an anxiolytic.
Okay.
I can't make that out.
Anxiolytic, anti-anxiety.
Thank you.
Anti-anxiety medication?
Yes.
Okay. And Flomax is what?
It's a medication that sort of relaxes urinary smooth muscle. So generally given to maybe an individual with a large prostate who is frequently urinating. It can also be used in individuals who have a kidney stone.
Okay. Then other than when you said what happened, you mentioned lorazepam, and then the regular medications being Valium and Flomax, were any other medications mentioned by Dr. Murray?
No.
At any time during your care for Mr. Jackson?
No.
Did you make an inquiry about any past medical history?
Yes.
What did you ask?
I asked what other medical problems Mr. Jackson had, if he had any cardiac history, if he had ever had a history of a blood clot, if he had any history of drug use.
And in response to that question regarding medical history, what were you told?
No to all of them.
Did you ask about any seizure history?
When I was attempting to determine what had happened with the arrest, I went back and asked about further details and asked if he witnessed seizure activity when he witnessed the arrest, if the patient had complained of chest pain associated with the arrest, and I was told no.
Okay. Did you make any inquiries about whether or not the patient, Michael Jackson, had been subject to any physical trauma, or did you make physical observations yourself as to determine if there's any physical trauma?
That's compound.
Okay.
Let
me ask you just your own observations. Did you note any physical trauma that would explain Mr. Jackson's condition?
No, there were no physical signs of trauma.
Okay. Now, from your own personal observations, what was Mr. Jackson's condition upon arrival at UCLA?
His condition was as described by the paramedics. He was clinically dead. He did not have a pulse. The rhythm on the cardiac monitor was what I would call as wide, slow, an agonal heart rhythm.
What does that mean?
Sort of a sign of a dying heart.
Okay.
His pupils were fixed and dilated.
when you say a sign of a dying heart, but you also said he was clinically dead, can you
Yes.
explain that?
The heart muscle is contractile, and it also has its own intrinsic electrical activity. And so the heart may still produce a signal, and we call it pulseless electrical activity, but clinically there is no pulse or sign of life.
Okay. So he was clinically dead. I believe you said his eyes were fixed and dilated.
Yes.
Was there any spontaneous respiration?
No.
And you said the rhythm was slow and wide, and I believe you said with no palpable pulses?
No palpable pulses.
And what does that mean?
That means when we attempted to determine if we could feel a pulse, suggesting his heart was beating and generating any sort of blood pressure or perfusion, there was none.
Okay. Now, despite this condition, in your opinion, of Michael Jackson being clinically dead upon arrival, were attempts made to revive Mr. Jackson?
Yes.
And as the emergency room physician, did you supervise and physically handle most of those attempts?
Yes.
Okay. And can you describe that, please, for us, exactly what transpired?
So when he first arrived, we confirmed that the endotracheal tube, the breathing tube, was in the correct place.
It was in the correct place?
Yes, it was.
Okay.
We confirmed with bagging and ventilating that the chest was rising, that we had breath sounds such that we knew we were breathing for the patient. I had confirmed there was no pulse. We instituted CPR, and then we proceeded to give medications in an attempt to resuscitate Mr. Jackson.
Okay. So the endotracheal tube, how were you able to confirm that that was correctly placed?
By direct visualization.
Okay, and what is it that you would see?
You would put a blade, it's called a laryngoscope blade, and you directly look to see that the endotracheal tube is actually going through the vocal cords into the trachea.
Okay, and that's what you were able to confirm?
Yes.
Is that yes?
That's correct.
Okay. And did you utilize an ultrasound at that point?
We did early on use an ultrasound to examine the heart.
Okay. And can you explain that device and what the purpose of that was?
In the emergency department, we will frequently perform limited ultrasound. I guess the most common reason people think of an ultrasound is when you're doing sort of prenatal care and looking at a baby. It is a device that is used by cardiologists.
I'm having a little trouble hearing. Could you repeat that?
Yeah, I think most people would consider an ultrasound as what we look at when we're looking at a baby. It's different than an X-ray. It gives us information about the chambers of the heart.
Okay.
Cardiologists would perform an echo. They do echo, which is that type of ultrasound. It's much more detailed than the limited ultrasound that we perform in the emergency department.
Okay. Looking at what was marked People's 47, may we dim the lights, please, Your Honor?
Please.
Doctor, is this the actual trauma bay where you worked on Michael Jackson?
Yes.
I'm going to hand you this pointer. Or I'm sorry, you have one there. Could you use the pointer? And if you could just...
How do I... Let's turn it on. Is it on? Oh, there we go. Okay.
Let's start to the leftmost part of the photograph. This appears to be a computer screen. And is that a keyboard?
That is a computer screen.
Okay, and what is that?
That is one of our computers that has, we have an electronic tracking system and computerized order entry, and the system is loaded on that computer. In addition, it has web access, and so that we can access medical records while we're in the resuscitation suite if we need to.
Okay. And then let me switch from People's 47 to People's 48. Looking closer to the corner of the room there, first of all, would this be the bed where Michael Jackson was placed?
Yes.
Okay. And what's the term for this?
It's a trauma gurney.
Okay. And describe for us what we see then in the photograph beyond the gurney, all of this medical equipment here.
This tool chest is our airway equipment.
And you've indicated the large tool chest with appears to be colored doors, white box.
Yes.
Is that where you're pointing?
Yes.
Okay. And what type of airway equipment is in there?
There are endotracheal tubes. There are other advanced airway devices. If we were attempting to intubate a patient and we could not place an endotracheal tube, we have rescue airway devices.
Okay. And above this, the airway equipment, this monitor here, what is that?
That's the cardiac monitor that the patient who is in the trauma room would be placed on.
Okay. And what type of readings would that give you?
That would have a EKG rhythm and sort of heart rate. It would have blood pressure. It would have the oxygen saturation. If the patient had an arterial line, as Mr. Jackson did, the pressure tracing would be connected and shown on the monitor.
Okay. And this would all, the readings that would be on this monitor would be from sensors and devices attached to the patient?
Correct.
Okay. In this area then, in the photograph, which would be to the right of the airway equipment and the monitoring screen, what is shown here?
There is, it's a little hard to see, this is actually a portable monitor and defibrillator.
Okay. And you've pointed, is that this?
Where you see the red and
okay, to the right of the airway equipment?
Yes.
Okay.
And although it's not clear to see here, there's a ventilator here.
Okay. And then how about this device to the right of the defibrillator, this pole, and then a device on top?
Without seeing a close-up picture of it, I'm not sure if which part of our equipment this is.
Okay, let me see if I can. Are you able to tell, or is it too blurred?
It's a little bit blurred. I think this is one of our smaller ventilator devices and not our other airway device.
It's a smaller ventilator device?
I believe it's, there's an oxygen tank. I believe this is portable ventilator and this is a bag valve mask, but I would have to be in the room and look at it to be sure I'm not misspeaking.
Okay. And going beyond that equipment, what is this cabinet here immediately to the right of that equipment?
This cabinet has several different trays, various equipment we would use in the resuscitation of a patient. This is a trauma bay, so there are tubes there are trays that we can crack a patient's chest open so that we can place tubes in people's chests. If we needed to do what's called a tracheostomy and sort of an airway where we went directly into the neck, that equipment is held here. There are central line kits, sort of type of IV kits that we will use.
When you said a tracheostomy, when you go straight into the neck, what is that exactly?
Instead of the endotracheal tube where we go through the mouth with a tube into the trachea, in some people that's not possible, and they will have an airway where we cut directly into the neck and place it. Emergency physicians typically will not put in a tracheostomy tube. That would be done by a head and neck surgeon, but we have the equipment here in case it's needed.
Okay, but that would be where you couldn't use an endotracheal tube, but you needed to ventilate?
Correct.
Okay. And then you mentioned at the bottom there the equipment for a central line. Is that what you said?
Correct.
And what's a central line?
A central line is, in essence, a larger and longer IV that allows us to access the central circulation quicker than would be a IV that was placed peripherally in an arm.
How is a central line put in place or administered?
So central lines are placed by the physicians. It's what we call the Seldinger technique.
The what?
There's a special technique that we use where we use a needle to puncture the vessel. We then introduce a wire and guide the wire through the needle into the vessel. We then introduce a catheter over the wire into the vessel.
Okay. And going then to the right of the equipment you've described, and I'm going to switch photographs as we move through the room. People's 49. Looking at People's 49, you recognize this as the same cabinet you just described on the left side of People's 49?
Yes.
Okay. So going then, continuing rightward around the room, what is this cabinetry or glass enclosed location here?
That cabinet has some IV fluids and I believe IV medications.
Okay. And is that a refrigerated cabinet, or what is that?
I would have to ask one of my nurses. I don't access these medications.
Okay. And what is this cabinet then going to the right of where the IV fluids are?
That's what we would call one of our medication pyxis.
And what is that?
There are several drawers here, and medications that we would typically use in the emergency department are sort of locked in this cabinet.
Okay.
The nurse will log on to this computer screen, log in the patient that the medication is being used, identify the medication that is needed, and that drawer will be accessed, and they will then note which medication was taken from the cabinet.
Okay. So the medications are locked inside this cabinet, and then by use of this computer, one can gain access to the medications?
Correct.
Okay. Is it password protected or?
Yes.
Okay. Going then to the right, the Pyxis system, where you can see it from there. This cabinet here, what is that?
That's a cabinet that contains bags of IV fluid.
Okay. You don't want to get into new areas. Is this a good time?
Yes, it is. Thank you. May we turn on the lights, Mrs. Vincent? And the IC console, please?